Hi, it's Kelly Mack, and today we're talking with Andrika Bluford. She's a nurse practitioner, and she's also the founder of Bluford Healthcare. Now, you're originally from Lawrence, South Carolina, but you practice in Greenville, South Carolina.
Yes.
So you're an educated woman, and you've been practicing over 20 years.
Yes.
So kudos to you for that.
Thank you.
Yes,
Thank
absolutely. I can't tell you how many times myself and my friends have specifically tried to seek out medical providers that represent us and who we are, because we want somebody that can relate to us and our medical background.
Yeah, that's right.
So you get that all the time, I'm sure.
I do.
Okay.
I get it all the time.
And you've been practicing for 20 years. Tell me about the moment that you realized, I'm going into healthcare and this is what I'm going to do.
So I lost my father at the age, he was 48 years old,
Sorry to hear
and lost him to a heart attack.
Okay.
And so at the time, I was working as a healthcare administrator.
Okay.
But it was at that moment that I realized that I wanted to be more hands-on and wanted to serve patients in a different way.
Mm-hmm.
And so I went back to nursing school that next fall, and I've been going ever since.
That's awesome. So did you start off like with your LPN and then your RN and then you graduated to, is it registered nurse practitioner, or was there like another step in between RN and nurse practitioner?
I started out as an RN,
Okay.
but I was an ADN, so which I went for 2.5 years,
Okay.
and then I went and got my BSN, which was my 4-year,
Right.
and practiced for 12 years, and then I went back and became a nurse practitioner.
Okay, awesome. And what's next education-wise? Are you trying to get to like being a PA and an actual MD, or are you like, hey, this is good for me right here?
I think this is good for me right here.
Okay.
I'm considering maybe getting my doctor's of nurse practitioner,
Okay.
but the thought of what would I do with it, how would it enhance my background and what I could do more for the people. So I'm thinking about it.
Okay, awesome. And you know, something that I wanted to kind of touch on is the fact that a lot of people, it's like, you know, they think of a nurse and then they think of a doctor, and they think a nurse is kind of like somebody who aids a doctor. But I know from personal experience that sometimes it's a lot easier to be seen and treated by a nurse practitioner a lot more quickly than a doctor, just because of the availability. And you all can do a lot of what doctors do as well. Can you explain some of those things that you can help people with as their nurse practitioner?
Absolutely, absolutely. When you think about a doctor versus a nurse practitioner, obviously the doctors have a little bit more educational time. But for us practicing, we're able to do just as much as the doctors are able to do. We're able to evaluate patients. We're able to prescribe. We're able to refer to outside providers just as the doctors are. So when you think about the scope and what doctors are able to do, there is really no difference in the services that we're truly able to provide. And I truly get that a lot, because as being a nurse before becoming a nurse practitioner, we as nurse practitioners are more exposed to that bedside manners and being able to understand the patients from a more hands-on perspective.
Okay, got it. So what about somebody with, I guess you could say, more healthcare needs, as far as somebody with maybe autoimmune disease, or somebody with a terminal disease, maybe cancer or something else? Are you able to care for those patients as well?
Absolutely, absolutely. And I have cared for those type of patients. My career, I have worked as a palliative care nurse practitioner, which is taking care of some of the sickest patients with the most severe and chronic diseases, and co-managing those patients with their primary care doctors, and oncology, which is the cancer doctors.
Right.
So yes, we are actually able to take care of those chronic patients just as well as doctors are.
That's awesome. And I thank you for explaining that, because I want people to know that they have options. You know, unfortunately, the way that the medical system is set up, the medical insurance is set up, you know, we feel like our options are few. But if we don't educate about options, then you'll never know about options. And there's been plenty of times that my son was sick, and I could not get in to see a doctor. But let me tell you something, a nurse practitioner was always available. And usually the nurse practitioner did exactly what the doctor would have done. And I was always grateful, for that option. But a lot of people don't understand the options again. So we want to make sure that we educate you today, because our motto is always to educate, inform, uplift, and to also give you options to explore, whether it's your healthcare or anything else in life. So real quick, the education portion, you went back to school because you were like, hey, I lost my dad at 48. He had a heart attack. This broke my heart. In honor of him, I want to serve. But not only do you serve, but you have a passion for serving the underserved. Can you tap into that a little bit?
Absolutely, absolutely. So when I was serving as a palliative care nurse practitioner, that is community health. That is going into people's home when they are very chronically sick, and some of those patients are terminal, getting ready to transition to hospice. Mm-hmm. And so going into people's homes, that is truly where you get to really tap into people's resources, their knowledge, their access to health. And it was at that point that I realized that 60% of the patients that I was caring for, it really wasn't that they was not compliant with the services or the care that they needed. Mm-hmm. It was that they did not understand. Yeah. They didn't understand. Most oftentimes when patients go into a doctor's office, the system is set up based off of numbers. Mm-hmm. And unfortunately, I have worked with a lot of great providers, doctors, practitioners, but when you're working into a health system like that, you're having to see patients, and that is based off of numbers. Yeah. And so oftentimes you don't get to sit down and truly educate that patient. You get to tell them, well, hey, your blood pressure is up. Mm-hmm. You need to work on decreasing your sodium intake, but you really don't get to sit down and have a true meaningful conversation as you and I are sitting here, right, and really educate that patient on their path, the things that they truly can do to help reduce them from having to be put on medications. Right. And so once seeing a lot of these patients and seeing them underserved, that gave me the ammunition to really want to be that trailblazer, mm-hmm, and go into the market and into the field and really support these patients, whether through providing care, advocating, educating, engaging in the community, just whatever platform I can do to be able to serve these underdog patients. That is what I want to do, and that's what Bluford Healthcare is trying to do in the industry.
And I am so glad that you brought that up, because I actually had a behind the scenes conversation earlier today about the healthcare system and being in this network. Whether or not and we don't have to name the networks, but typically, we can. There's Prisma, there's Atrium, there's Novant here in the Carolinas. Mm-hmm. There's a lot of different healthcare systems. And usually, you see a doctor. If you have an issue, they send you a referral of someone in the same hospital system, the same network, which, mm-hmm, we think is the standard, but you offer private care and private options. Now, doing that, how does that affect somebody with either insurance, no insurance, Medicaid, Medicare? Like, how reasonable is it to have private healthcare versus network healthcare?
So, sure, that is a great question. When people have come out to private care, the thing that it gives a provider most of all, it gives more autonomy. Okay. If you're skilled and you're strengthened in your scope of practice, then a lot of things with the patients you can keep in-house. Okay. So whether that be a type 1 diabetic and their diabetes is out of control, I get to make that determination. Can I control that patient diabetes in-house, or should I refer that patient out to the endocrinologist? And I will tell you, most oftentimes, because of my experience, I'm managing it in-house. Okay. I am managing it. I am working, whether that is through a network of trying to better educate the patient or be a resource. I'm walking that patient through it 100% of the way. And if it's something that I can't manage, then I'm working in the community with care navigators, trying to get this patient access, mm-hmm, to that specialty care at a reasonable cost.
You also offer weight loss management, and I know a lot of people are trying to lose weight, whether it's for health reasons or just to regain their, self-confidence. Can you talk about the weight loss management program that you have?
Absolutely. We have a weight loss program. It's called Transform and Thrive, and so it's where we are working with compounding pharmacies. We're working with nutritionists. We're working with a physical health and wellness coach and trying to target those patients that have a BMI greater than 30 or have pre-existing heart condition, lung conditions. And so basically we do an initial consult with the patient, kind of focus in on what their goals are, what their weight is, what their health, what their comorbidities is. And we individualize, create a focused plan with the patients, get the patients on the program. We meet with the patients every week, evaluating their weight, their measurements, their changes in eating behaviors, their physical activity, and just kind of coach the patients through and help them get back to a healthier weight and keeping them on track through our program.
Okay. And this would be long-term weight loss in the sense of whatever measures you're using, people can look back 6 months from now and still have that weight gone versus people that as soon as they stop doing whatever the program is, they gain all the weight back.
Absolutely, okay. Yes, because what we try to do, we really try to help the patient learn to change those behaviors.
Got it.
Not just focusing on chemical substances. We really try to help them with those change behaviors because the weight is going to come off, but we have to really kind of keep them on target with the changes in the eating habits, decreasing those sugars, decreasing those carbohydrates, and then increasing that physical activity. And we've had a lot of success with this program.
Got it. And something else you mentioned earlier was natural healthcare and allowing your body to heal and educating yourself on how you can do that, which I can appreciate because a lot of times when we go to the doctor, oh, high blood pressure, here's a script versus, oh, high blood pressure, let's try to get you to lose 30 pounds and maybe talk with a dietitian so you can have healthier options. And I hate medicine. I'll be honest with you. Like, I hate to take it, even my allergy medicine. So I like to explore other options outside of just giving me a pill, which is going to cause all these other side effects. So it's like, okay, well, we'll give you this pill to help out with your sensitive skin, but you're probably going to gain 30 pounds because it's steroids, you know?
Yes.
So I can appreciate that about you. So kudos for even having that mindset. Because I spoke to a doctor recently and he's like, I was like, okay, what are the alternatives? No alternatives. Take the pill. You came to me for the problem. Take the pill and hopefully you'll get better. Not you're going to get better, but hopefully you'll get better. But there's no other alternatives to this equation. And it's like, no, you paid me for a job. Here's the job. This is what you do. And I feel like there needs to be tailored healthcare and it needs to be tailored to individuals. That's and right. Not a group of people that are 5'2", weigh 145 pounds and that are between the ages of 30 and 50. You know what I'm saying?
Yes, absolutely.
So, how can people reach out to you? Like if they just want to talk to you and explore options as far as, you know, changing their healthcare, I guess you can say healthcare needs to private care, how can they reach out to you?
Certainly. They can visit my website, on my website, which is www.bluford-ha.com. There is a link for info on there. You can reach out to me that way, or you can give my office a call. My assistant is always available, and at that number is 1-843-638-3119. And generally, I am very responsive, where little to no wait time, same day return calls. I try to be very, very responsive in terms of engaging patients because I understand the sensitivity when it comes to patients and having questions and exploring options and just wanting them to be able to get the best answers and support that they need.
Yeah, and we need more people like you in the healthcare arena because I've made phone calls myself and I'll get a call back the following week. It's like, oh, well, you know, I done went to the ER by now, you know, because you wouldn't call me back. I love the fact that you understand, and I get it, you know, when you're dealing with a lot of different patients, you know, you have different procedures, you have different people that you're seeing, and sometimes the day gets away from you a lot quicker than you may want it to, but there's also people that that still have pressing issues that haven't come into the office or that haven't even been able to contact you about their signs and their symptoms.
That's right.
So I love the fact that that's important to you.
Yes.
Absolutely. Well, again, today we're talking with Andrika with Bluford Healthcare. She's been practicing over 20 years, and she has her own private practice in Greenville, South Carolina, originally from Lawrence, South Carolina. And something like we'd like to do that's fun before we wrap up interviews is 5 things that we typically wouldn't know about you or about something in the healthcare arena, since we're talking healthcare today. So first and foremost, as an individual, I know that you have to be very busy in your line of work. So how do you, number one, decrease your stress and just kind of woosah and kind of reset? What is your number one way of doing that?
I get away.
Okay.
Shop.
Okay. She's a shopper.
I'm a shopper.
Okay.
But seriously, I generally will, kind of like isolate myself, go into the room and just kind of debrief. And a lot of times I reflect throughout the day or even at nighttime, just trying to find some time for myself and just kind of debrief is generally what I usually do each night.
Okay, awesome. And, speaking of stress, we hear it all the time. Stress is the number one killer. Would you agree or disagree with that statement?
I would agree.
Okay. So can you talk about how that is so? I have my own assumptions that, when you stress, I'm told that certain things release in your body, chemicals or what have you, and it can attack anything in your body, whatever's weakest, whether it's your colon, whether it's your uterus. Can you talk about that from a health standpoint?
Absolutely. When your body is in stress, your body starts releasing cortisol, which is a natural stressor, which then increases stress on your heart. It weakens your immune system, makes us more at risk and susceptible for getting sick. Is usually some of those things that added stress will cause on our bodies.
Okay. So question number 3 then, since we're talking about stress, how can people eliminate the stress? It's so easy to say, stop stressing, but how do you stop stressing? People are dealing with financial disparity issues. People are dealing with loved ones that are sick, and it's like, oh my gosh, I want her to be well. I want him to be well. Oh my gosh, now they got to have this surgery. They have to have this procedure. It's natural to stress, but how is the best way to eliminate those stressors? And also, I guess you could say, cut back on the amount of you said cortisol? Cortisol that's being released in your body.
I think one thing with dealing with stress is you really have to kind of try to distract from what the root cause of that stress is, and also try to incorporate self-care into your life, because as an individual, whether you're in your profession or just your home life, our life is so demanding, and it's so easy to get caught up into the day-to-day that sometimes we really forget about ourselves, caring for other people, or just, doing things for others. And so I think that it's really important to try to set aside time for yourself, try to find hobbies and try to find ways to minimize that stress. Stress is going to always be there, right? We know that that's the common thing, but just trying to find ways to, whether that's talking, communicating, and talking about the problems, things that are causing you stress, trying to figure out ways to alleviate that stress, or, whether it's take a walk, go exercise, anything to kind of eliminate or minimize that stress off of you, to distract it, will kind of help bring down those cortisol levels, take that stress off of your heart, opposed to weakening your immune system. So you gotta try to find a balance there.
Okay, awesome. Great information and insight too, by the way. All right, so question number 4, a lot of people, when they get sick, some people will call the doctor right away, or call their healthcare provider right away. And some people will wait until it gets really, really bad. What is the rule of thumb as far as you're concerned when you should reach out to a healthcare provider?
Actually, I am very pro healthcare, and if it's something that is new, or if it's something that has not been there before, I think it's always important to seek out medical attention, whether that's through a phone call or through a whatever portal that your health system may have. I think it's always, as a rule of thumb, and being cautious to reach out, because things happen so fast, and especially with our population and our race. One thing that I like to think of is hypertension. It is such a silent killer. It is truly a silent killer. And so the multitude and the way it attacks the body and the multi-system that it affects, you just never know. Right. And so my rule of thumb, if you feel sick and you feel that you need some type of healthcare attention, then you need to say something if you're feeling a different type of way.
Yeah, definitely. And then also, I want to stress the importance of seeing your healthcare provider at least once a year for a physical, because we need to know what our numbers are, especially after you hit 25. Absolutely. Believe it or not, we need to know what that cholesterol is looking like, what that blood pressure is looking like, what those sugar levels are looking like. Absolutely. And then there's other things they check for too to indicate. Like I had a friend out of Greenville, a matter of fact, I read about his story. He had cancer, and he's like, I felt great, and I got the blood results back, and he ended up finding out that he had markers in his blood that indicated cancer, and it ended up being prostate cancer.
Yes.
So he's like healing from that and coming through the process of, going through chemo and radiation and all of that. But he was like, I would have never known if it wasn't for that blood test.
Yes. Preventative health care is so important, and I cannot stress that enough to people. You should see your doctor or your provider at least once a year. Those screenings are so important, because if we're able to detect these chronic diseases or situations early, it's better for us and yourself to be able to treat them. Because most oftentimes, whether we're doing labs or we're doing annual exams, we as providers, we don't just look at it as a one-time basis. We usually trend. And so just being able to watch and wait and see this type of information gives us good insight to be able to provide and determine better care measures for the patients.
Okay, awesome. So get in front of it, not behind it, okay? If something starts feeling different, even if you had that physical, make a phone call, Right. It could be something significant, it could be something minor, but let's leave it to the professionals to determine and not you. And oh my gosh, can I also stress that Google is great for information, but don't use Google to diagnose yourself, because you'll be in a world of trouble.
I agree. Leave Google alone.
Yes. And final question, I've always wondered this, with you working in healthcare, I know you see everything from broken bones to COVID to the flu to even cancer. And I just wonder, how do you not internalize that personally? Like, do you go home and think about your patients? Is it something that haunts you, or is there a switch that you know how to turn it on and off?
I internalize it, and they tell us not to do that. But as a human, as a mom, just as a genuine servant person, I internalize it, and I get so involved and so wrapped up into it, because when you build those relationships with your patients, you got to gain that trust. Right. And to be able to gain that trust is a huge step and pathway with patients. Yeah. And then once I've gained your trust, I don't want to just turn my back on you. Mm-hmm. So most oftentimes when I'm dealing with a chronic patient, in which I have, most oftentimes I'm at home, I'm in the bed, I'm thinking, what can I do differently? Is there anything I can do differently? Did I do the correct thing? Is there something else I should have told that patient? So there's a lot of self-reflection on the patient, just always trying to strategize, how can I improve on the care delivery that I'm providing to my patients and their families as well, because they're all endeavoring it, not just the patients, especially with the sicker patients.
Yeah. I totally get it. When somebody trusts you and believes in you, it's hard not to have an emotional attachment. Mm-hmm. It's hard not to care, because, it's something that you saw in me while you're sitting here, while you're trusting me for your healthcare needs or whatever those needs are. Yes. I can't just not care. That's but right. A lot of doctors have been trained to turn off that human switch, which makes you a number versus a name.
That's right.
That's incredible. Well, as we wrap up today, real quick, if somebody wanted to reach out to you, I know you already gave some information earlier. What's the best phone number they can call?
The best phone number is 1-843 638-3119, and that number will take you directly to my office.
And your website again?
www.bluford-ha.com.
Okay, and before we call it quits, I love to do this. If there's anything motivational or inspirational that you could share with those watching this video today, what would that be?
Get in front of your health care, because it is truly important.
Awesome. Thank you for joining me today. I appreciate you. I was very well informed today. You have amazing insight. She's also really fun to be with, guys. You know, some of the healthcare providers, they're a little bit uppity, kind of a little stuffy. Not the case with nurse practitioner Andrika Bluford of Bluford Healthcare. Thank you so much for joining us.
Thank you for having me.